F.A.M.E is the Family Association for Mental Health Everywhere. It's a not-for-profit association that was formed 20 years ago by families in Etobicoke in support of other families who are challenged and living with a family member who has mental illness.
1 in 5 Canadians experiences a mental health issue in their lifetime.
It's the #1 health issue, and it's the #1 challenge in the health system in this country.
Good afternoon, F.A.M.E.
F.A.M.E is unique because it reaches out to the whole family.
When family members are supported, the person with the illness can do much better, and that's a key part of a person being able to manage with a mental illness is by having a strong community and family members around them.
We offer a one-to-one service where people can reach out and have private consultation.
F.A.M.E has grounded us, always provided support for us to know we're not alone, we're not so unusual, we're not the only family with this.
They can phone us on a telephone and talk over a telephone almost anonymously if they really wanted to, because there's so much stigma attached to mental health issues.
I would like mental illness to be brought out of the closet. I don't want it hidden behind the door anymore.
We offer monthly group supports.
So when you come to the groups in F.A.M.E, you're sitting with a group of people that do understand. You know, they're experiencing their own unique situation, but they do understand what having a mental health issue in the family is all about. You know, when you're in that group, people get it, and that matters.
We offer very practical educational forums where people can get the ABCs and the basics of how to navigate the mental health care system.
We also have socials for our clients in terms of we have our regular June summer social, and we have our annual holiday parties as well. And we feel that's a great opportunity for people to get together and feel as they're part of a larger community.
We've got a couple of opportunities to participate in the Toronto District School Board. And
when you're looking at mental health, it is a recovery process that you're going to have ups and downs, and I think it's important that they need to realize that they have to take care of themselves as well.
So I think we as caregivers have to stay very healthy, happy, positive, full of humor, have a life, and deal with the situation and do whatever we can. But do not let the illness become our total life.
And I think it's important that for them to be aware that their voice, that their experience, that their input that they have with their relative is just as important as any professionals.
We know how to talk to families. We understand how they feel.
F.A.M.E has been there for the entire time we've been dealing with this. Yeah. From our first contact with F.A.M.E, I mean, anytime we picked up the phone to contact whoever the worker of the time might have been, they were always there.
We teach families how to support other families. In some ways, it's almost, there's a peer support development. It makes us very unique that way.
And it's a really nice feeling to know that there's somewhere you can go. Because we remember very well the time where we had nowhere to go. We didn't know where to go.
We empower, we enable, we educate, we strengthen families.
I would say to them that not to lose the hope, and that there is help out there and they don't have to go alone.
Nobody does what F.A.M.E does. We are the only organization whose programming is solely based on family support.